Right now at 11, a triple health threat this winter. Doctors are seeing a jump in flu, RSV, and COVID. Experts warn it could be the worst flu season in years. The respiratory virus is making a comeback. It's a warning we've been anticipating since the start of the pandemic. In the last week, measles now added to the list. But can hospitals keep up with this demand? 10 TV's Richard Solomon live tonight in studio with those answers. Richard.
Andrew, let's first start with the flu. The Ohio Department of Health reports as of November 26, there have been more than 1,400 flu-like related hospitalizations and more than 4,100 people are infected. Dr. Joseph Gastaldo with OhioHealth says that's not the only concern hospitals have tonight.
As we get closer to winter, a threat looms you can't even see. Health professionals across the country are sending warnings about winter flu and respiratory illnesses, saying this could be the worst in years.
If you need help, get help.
Lisa Christensen is a mom of two Westerville students. This week, Columbus health officials announced a reported measles case in the district. Although her kids are vaccinated, she told me, as a mother, her worry never stops.
It's different. You have to think about your kids are sick and paying attention to your kid, what they're saying and what they're doing, and are other people sick? And, my daughter says, oh, we had 3 people out with the flu today. Then I'm going to think to myself, I should probably pay attention to see if she shows any symptoms.
I spoke with Dr. Joseph Gastaldo with OhioHealth. He says they're seeing a lot of respiratory virus infections and influenza admissions in their buildings.
On average, this week and last week, we have about 400 confirmed hospitalizations in the state of Ohio from influenza. And if you look at where that was on average over the preceding 5 years, that's been below 50.
He says doctors are keeping a close eye on 3 respiratory illnesses: influenza, RSV, and COVID infections. He says a big reason why doctors are seeing more hospitalizations is because fewer people are wearing masks inside. Dr. Gastaldo says hospitals can handle the potential surge, but what's concerning is the staff.
Healthcare workers are part of the community. So if we have a lot of people out with COVID, influenza, RSV, or for that matter, any other respiratory virus, that's where it's going to be challenging to have enough healthcare workers to take care of hospitalized patients and those in the office.
His best piece of advice, other than getting vaccinated: watch how you're feeling. Dr. Gastaldo says if you feel sick, stay home, monitor your symptoms. To Christensen, it's a lot for a parent to deal with these days.
I don't know. I'm not nervous yet. I hope it doesn't become anything.
And if you have any plans to go out shopping this weekend and want to avoid any kind of illness, Dr. Gastaldo says it's never a bad idea to wear a mask or face covering. Andrew?
Great information, Richard. Thanks so much. Many parents telling health experts that the symptoms for each illness can be a bit confusing because they're quite similar. So we've created this chart. Take a look. It can help clarify. On the top, it shows the illness. On the left, it shows the symptom. The check mark representing a symptom you'll likely see from your child. Hopefully this will give you a better sense of what symptom aligns with each illness and when you should call your doctor. We posted this if you want to take a closer look. It's on our website at 10tv.com/featured links.